Joining us now is MSNBC medical contributor and former Obama White House health policy director, our friend Dr. Kavita Patel, and Mara Gay, New York Times editorial board member and MSNBC contributor, and importantly, a brave person who has shared her own stories about COVID. And I wonder, Mara, to you, you've tweeted about your first runs and some of your trips back to doctors. Is this overdue, some of the science and some of this reporting on the long-term symptoms of COVID?
Yeah, thank you for your support, first of all, Nicolle, and for allowing me to talk a little bit about it. I appreciate it. You know, the whole time, the whole pandemic, we've seen these stories here and there and some good coverage about these long-term effects. But the conclusion that we reach in these news articles and from doctors who are interviewed is we just don't know. That's fair. That's true. We don't know how long this will last, who will fully recover, who may have some lingering symptoms or some flare-ups. But I think we really need to move now away from that and move into helping this large group of Americans who was previously healthy and now needs serious support. And that means research, dedicated research. That means finding new treatments, and sometimes it's going to be older drugs that actually work wonders in long-term COVID patients. That's going to be emotional support, and also some people are going to need to go on disability and already have. So there's a whole constellation of people who are dealing with all kinds of issues. And I think, you know, just to give a little bit of hope, I mean, I am getting better slowly. A lot of us are. So it's really not enough to just say, well, some people may never recover or may have some long-term symptoms. What does this look like? What does healing and recovery look like for people? And where can they get that help? It's really time to start that conversation. There are going to be, unfortunately, millions of Americans in this position.
Mara Gay, you stop me in your tracks the way you talk about this, and you always change, I think, how I think about why we're protecting ourselves. We're protecting ourselves for the most vulnerable. We're protecting not just ourselves, but we're, as Rachel Maddow now talks about, after Susan got sick, we're protecting the person on the planet we love most. But I want to just push you even further. I mean, have you built your own community in the absence of all of this? And we don't have any of this. We don't really track these patients. We don't have the emotional support really for anybody. We just don't do a good job at that in this country. But what have you been able to build from your own experience and your own willingness to talk about it?
Sure. One of the biggest blessings that has come from sharing my experience, other than people who say thank you to me just for, you know, forcing them to take the virus seriously, are the Americans who have reached out to me offering help. Some of them are pulmonary rehab specialists who I'm working with now. I'm in pulmonary rehab twice a week. I'm somebody who, just as a reminder, never had asthma, no pre-existing conditions, 33 years old when I got sick. That's helping a lot. I've taken up yoga. There are support networks, which I think have been very helpful for a lot of people. There's a small group of doctors in the country who are talking to one another, who are, you know, the experts, so to speak, if anybody is, on all of this that's going on. They've been very helpful. It's very overwhelming and difficult to find the right help and the right team of doctors. And I think that's one thing that these survivors are dealing with. And then I think just emotionally speaking, it's very difficult to go from being perfectly healthy to having a long-term or a chronic illness that you're taking months and months to recover from, to regain your life. So I think, you know, having support from friends, I'm very fortunate. And frankly, also from your employer. And the New York Times has been extremely supportive and understanding. And I couldn't do it without all of this support. So I often think about what happens if you don't have healthcare. What happens if you don't have access to an acupuncturist, to a yoga treatment? I mean, people need way more help. And there's hope, too. I mean, I don't want to see any of us cast aside and treated as though we don't exist, or worse, as though it's hopeless. We are getting better, slowly.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.